Oh, wow. If I do that, you're going to strain something, right? Jauan Jennings, calf injury. What exactly is going on? We don't have any video of it. We don't know what happened. We know that he tweaked something in his calf, and since then he hasn't been functional and full performance and anything since then. And he hasn't fully recovered, and there's chatter, is it contract related, is this related or whatever, and all his imaging and all his tests are negative for major injury. What happened with his injury? We don't know yet. Now, I have had plenty of patients that have come in and I examine them, and anatomically everything seems normal. They may have a little bit of a click, but there's nothing on the MRI. They may have like tightness of one of the bands, like whether it's the lateral gastroc or medial gastroc, and they have some foot pain. And when you examine it, you say, well, the range of motion isn't full. They have tenderness in various fascial bands and sometimes even tightness in certain chords of the muscle. And the treatment, whether it's deep tissue, Rolfing, has transformed many of my patients. Some patients that have had shoulder problems and even a frozen shoulder. Non-traditional complementary alternative modalities often help. You don't have to do surgery on everyone. And so there's so much we don't understand, but the MRI will say that the tissue looks normal. But how much is the MRI actually telling you? It's telling us a lot about the big injuries, but is it enough to tell us about some of these sort of non-specific injuries, pain? I mean, we have an entire specialty of pain. Why? Because we can't figure out what's wrong when the patient has pain and we don't have something we can treat that's broken, right? If we can't physically see that this is torn, can you have a guitar string sound when I do that? Like just a little pluck, yeah. So when we don't see something completely disrupted, then we say they're anatomically normal, they should be fine. Well, no, that's not true. Now, I don't want this to seem that I'm saying like, oh yeah, go ahead, you athletes, no one's ever gonna know, you're gonna fake an injury. Trust me. I've had plenty of patients come in, pretend to have injuries that have, signs and symptoms that tell me they're trying to fake it or they're inconsistent. We can tell if you're faking it. Trust me. Now, back is a big dilemma. But I'm telling you, like if I actually place my hands and examine and feel for the various components of your leg, back, or your foot, and I'm finding diagnostic indications, I put that in the report. Why is that important? Because it's objective findings. You can't fake something because I can examine a patient and I'll test them in different ways. And if everything is 10 out of 10 and I can't find anything, and no matter what I do and all the imaging is normal and they're always 10 out of 10 pain, it's out of my hands as a surgeon and treating physician. Obviously, I send them to the pain specialist because there is so much we don't know. But please keep in mind, we didn't even know the atom existed until we saw it. We didn't even know what electrons and neutrons were until we saw it. Diagnosis takes time and is limited by the accuracy and precision of our current tools. If I didn't have these glasses, or Benjamin Franklin didn't have these glasses, would he have done what he did? Probably not. Would we have seen the moon without a telescope? Probably not. Would we even know about actin or myosin without an electron microscope? Probably not. So, when someone has an injury and there's no diagnosis, and we see this all the time with, insurance companies, is like the radiology report doesn't say anything. Well, as an orthopedic surgeon and as many surgeons out there, we actually look at our own images. You never trust someone else. And nothing wrong with radiologists, but they've never examined the patient. They don't examine a patient like we do when we see the patient in the office. But again, how much of a patient's function is actually measured by when we see them in clinic. It's fractions of a percent. I mean, it could be less than 0.1% of an entire human lifespan. And we see them in the office, do an examination in the clinic that's not real world, full of Hawthorne effect. Hawthorne effect, you can look it up. It's basically like the error that happens when you know you're being watched or measured. So in Europe, it's very common for patients to, complain to the nurse and complain to the training doctors, but when the actual surgeon attending registrar comes in, they say, "Oh, I'm fine, doc, I'm doing great." But they complain differently to a different hierarchy. So it happens. We know injuries can happen, and we know oftentimes we still don't have a diagnostic accuracy of what's going on. We can say back strain, we can say calf strain, we can say leg strain. Like for example, if I do this, he almost got away from that. Like, come on, Charlie. Oh, wow. If I do that, you're gonna strain something, right? Well, Charles is good. Oh, Charles, I'm sorry, Charles. You're right, it's Charles now. But you can have a strain in all sorts of muscles. Now, we know deep tissue works. We know massage works. We know acupuncture works. We know that there's so many different modalities that work, and yet all the imaging is negative. We know cupping works, yet all the tissues, based on current imaging techniques, which is all static. The MRI is static. So unless you have arthritis, inflammation, something broken or something ripped or something torn, we don't have the quantified, telemetric, diagnostic precision or accuracy to tell you what's going on, because we're not able to look down into the ratcheting and and we don't see the biochemical, biophysiological, deep down nanometric processes that are happening. So injuries can be a diagnostic dilemma. There's back injury athletes, and there's chatter that, oh, well, they're just trying to get a bigger contract. They're faking their injury. We don't know that. Athletes work hard. They're hard workers. We can give them a break. We can have injuries. Like, for example, I had a back injury a couple decades ago. Kind of strained my back, tweaked my back a little bit. Everything was negative. I was walking crooked, I was sore, and it took me a lot of recovery, rehab, and not just in-person physical therapy, but my own dynamic stretching activities, yoga, Pilates, and Pilates saved my back. I don't do it enough, but Pilates for me saved my back, but everything was negative. I mean, I was like, on painkillers like Tylenol, naproxen. I avoided anything stronger than that because I just didn't want to have any, issues with my attention span and my ability to work. But working with pain, playing sports, I couldn't bike anymore. It was incredible. I actually came back. I was training for the triathlon. I mean, I actually completed the Alcatraz triathlon, and I've swum Alcatraz 3 times, so proud of that. But it was sometime after doing all of that, and this was already after I blew out my knee playing soccer, my ACL and all that, and I recovered, and then training for an Ironman distance triathlon, never Ironman. I was never good enough. It was almost like I had a second job doing it, and then I suddenly tweaked my back, and I'm like, what's going on? All the testing was negative. It was incredible. Now, if say we had a precision joint kinematics imaging system in the real world, in real time, that saw everything happening, imagine that. Then we would see what's going on. We would see that some of the muscle fibers may be tight. They're tethered. They need some stretching in a few centimeters of the fiber, not the whole fiber. Can they still do a straight leg raise? Do they have their hamstrings fully extended? But even if they do, there could be small components that are not fully functional. And then the entire neuromuscular component. There's the mental health component. Now, there are plenty of patients that I have seen that have true injuries and pain that there's nothing on the MRI, so I can't treat them as a surgeon, but I am convinced that there's something. They're not faking it. And it's not a mental health disorder in the fact that they have a mental health disorder that's affecting them and they don't want to play and that they're faking an injury. No. I'm saying that they could have true mental health disorders, or they could have a true disorder in their leg and it's not mental health, but their mental health is affected because they're losing their confidence. And so they can't fully push themselves because they're afraid of getting injured. They know something's wrong. Athletes push their bodies to the limits and they know something wrong. And more often than not, I have seen patients coming to me, I'll tell you, Joey, and they tell me no one's listening to me. This is where it hurts and no one's listening to me. When I went to see the doctor, all they did was have me do this, but my pain is over here and they could never figure it out. It happens. There's so much more that we don't know than we do know. And what is that percentage? I don't know what that percentage is. But what I do know is that we know a lot more now than we did 100 years ago. And we're going to know a lot more in 100 years than we know now. So that's my spiel. Did I lecture too much? I think I'm lecturing.
I think it's good.
Is it good? Mm-hmm. All right. Okay, cool. So Jauan Jennings had a calf injury. We don't know what it is, but maybe it's going to take time. Maybe it's going to take his contract. What I do worry, and I think this is some of the chatter out there, is that, he's delaying until he gets his contract and then he's going to go back into the game. And then the concern is, what has he been doing since the injury? Has he been doing the rehab to recover? Has he been doing a progressive rehab to get him ready for the game? We don't know, right? Or maybe we do. Some people say they know. Some people say he's not doing anything. And so he's at high risk for injury once he goes back into the game, because you go from doing nothing to full tilt. Okay, there's no gradual curve. We could use the word hyperbole, but there's no gradual curves. He suddenly just jumps and goes into full tilt in the game. That's hard. That's hard for anyone. If I hurt my back, I'm not going to be able to do triathlon in a couple weeks. The best example that I ever heard was in interviews with Tour de France riders. And a number of them actually said, this was in a documentary I saw, it could have been during the Tour de France a few years ago. And in that, they said that if a Tour de France cyclist doesn't ride for 2 weeks, it takes them 3 to 6 months to get back into cycling shape. Imagine that. That's how far they're pushing themselves. So it's hard. Their job is hard. If you work hard, whether it's any kind of laborer, you work hard. You're hurting your body. Does that mean a Silicon Valley engineer deserves more than a sanitation worker who's taking your trash? Our trash? They're literally, they have a truck. I've treated sanitation workers. They work hard. They tell me about how they sometimes have to go down because some of you decide not to put your bins a certain way, or you're running out and handing it to them at the last minute. They have to step out. It's okay. It doesn't matter. It's not good or bad. Let's not dismiss anything. Whether you're a sanitation worker, a carpenter, a pro athlete, a college athlete, or a surgeon who's doing arthroscopy or hammering, it doesn't matter. You're a police officer, you're a fireman. Hard labor hurts. So let's all give them a break. No pun intended. And let's see what happens. So I hope, Jauan Jennings, you're good. Sorry, Charles. That was loud. Can we cut out that slap? No. Okay, fine. All right, see you next time.